Digital transformation for West Herts simply means that we are looking to utilise new technologies in order to improve patient care. The upcoming hospital redevelopment gives us a fantastic opportunity to now start building in new technologies into the infrastructure. Embracing the new technologies will ultimately create a better working environment for our staff. This will allow them to focus on the most important aspect, which is to provide the highest level of care.
COVID-19 pandemic has completely changed the way that we approach the management of patients and the care of patients. So as such, it's really been the agent of change. We've had to completely rethink the way that we interact with patients now. And that has meant that we've looked to digital platforms to create as good a proxy for being in the room with the patient, but actually not being in the room with the patient. You can do telephone appointments, but for me, they don't quite do it because you can't pick up the nuances of patients' body language and some of the more subtle messages that you can only see through a video consultation. Microsoft Teams or Zoom are now enabling a new type of interaction. In the outpatient setting, we're providing quite clever tech that they can wear or use in their own home, which mean that they're updating records in terms of their pulse, oxygen levels. They can see that we've reviewed the results, and that gives them much more control over their condition, and we're finding that patients really like that.
I found the virtual consultations to be a good bridge between being in hospital and being at home. I was able to rest and be around my own creature comforts, where I also knew that my data was being looked at every day, and obviously the ticks would appear, so I could see when the data had been seen. Instead of being alone in my symptoms, I knew that, okay, they're trapped somewhere. Someone knows that I'm still feeling rubbish. I'm not completely on my own, but they're leaving me alone enough. I think it was the best of both worlds, ultimately.
Digital transformation for me means that we're now going to be able to bring the whole team to the patient. We'll be able to see real-time information from large numbers of patients simultaneously, and this will obviously facilitate quicker and more efficient decision making. This is going to just push quality up further and further, and that has to be good for the patient.